So, Dr. Daya, thanks for joining us.
Pleasure.
Um, what was it that drew you into a functional medicine approach or more of a root cause approach early on in your career?
Two things. One is doing the highest quality at whatever I do. It's just my nature. And then the second thing was trying to understand and not just memorize, but understand things. So I was in practice for a couple of years, had a woman with panic disorder who really wasn't getting better. I've told this story so many times. And I tried everything that was available at the time, CBT and group therapy and all the meds that were available, and nothing was working. My hypothesis was she was having panic because she was in a bad marriage. A year in, she paged me with a panic attack on Saturday night. I went into the office Monday morning thinking, something is going on here because she should be better by now. I had one piece of data, I had a CBC, and the only thing that was abnormal was the MCV, the size of the red blood cells was 101, but the range was 80 to 100. And I had ignored it because, you're trained in a hospital setting, you treat train wrecks, you don't treat the subtleties. And, it could be B12 deficiency, worked her up, Schilling's test. She comes back abnormal, give her B12 injection. And with her first injection, her panic is gone.
Mm-hmm.
Like, oh my God, what else am I missing in my patients?
What do you think are some of the causes that's led to our country's historic rise in anxiety and depression? We'll just focus on those two. What do you think's contributing to those things?
I do think that the biggest thing is very broad, and by broad I mean cultural failure, and I mean environmental failure, because we're swimming in toxic chemicals, thousands of endocrine disrupting chemicals, toxic chemicals. If I had to say one thing, I would probably say the breakdown of the family and the and the and the larger community. I'm not even going to talk about the whole country. I'm just going to say people are not really embedded in a community. They don't even know what community means anymore.
And so in your practice, if we focus in on depression and anxiety, because it's such an overwhelming number of people, are there some common threads you tend to see, maybe where lab work is helpful, where medications or supplements can be helpful? What are some, if someone comes in with depression or anxiety, where does your mind migrate first?
I would give you this analogy, broadly. I'd say, we have hardware, we have software, and we have the cloud, right? Hardware is your body, right? What's going on in the body? The software is your thinking patterns, your values, your way of looking at yourself in the world, right? That's your software. And then you have your cloud, which is the spiritual, okay? You can't really, it's hard to repair the cloud, the spiritual connection, until you have the hardware and software working. I mean, you could work on it, of course. If you've worked on the cloud before and then you get ill, you actually have protection. But most people that come in know the hardware is a problem. So you want to take a very careful history and look at the various systems, digestion, nutrition, immune function, infection, inflammation, detox, oxidative stress, hormones. All the hormonal systems are known to affect the brain. Structural problems, chronic pain, sleep problems, lifestyle problems, etc. You want to survey all of that and see where do you think the problems are, the main problem. But remember this, remember that if you can work on those pillars, sleep, diet, movement, spirituality, right? Movement I mentioned. So if you can work on those, many things improve. Many things improve.
Mm-hmm.
You do, your screening blood work. If I had to say what would I do, I always look at the adrenals and the thyroid. I look at 8 a.m. ACTH and cortisol. I'll often do either a salivary or urinary cortisol through the day, so I get a better picture really. And then thyroid, always looking at thyroid function because it plays a big role. And look at the homocysteine. In order to assess B12 and folate, I always look at the CBC, iron indices, and I'll look at the homocysteine. And then you look at how those relate to each other in a dynamic way, because you can mask a B12 deficiency with low iron, right? So So you really want to need the iron to factor that in. And then I will look at insulin, and then I will let's see. I probably look at inflammatory markers. If there's symptoms of inflammation, I'll do CRP, sed rate, C4A, TGF beta 1, maybe a couple of others, depending on what I see at autoimmunity or something like
How much more do you think you have enjoyed psychiatry practicing this way versus the way you were trained?
that. There's no comparison.
No.
Listen, when I first went into psychiatry, I would wake up every morning thinking, how blessed am I to be able to do this? But after about 2 years, I was like, okay, he's one of those, she's one of those, I'm one of those. Everything's classified, everything's the same. And I was like, oh my God, I got to do this for another 40 years. Oh my God. And then I called my mentor from Georgetown. I said, Frank, I said, like, I don't know what to do. It was Frank Calabat was his name, great guy. He says, if you don't keep learning, you're going to be in trouble. And I was like, oh, that's the key. I got to keep. Let me tell you one other thing. I learned in 2017 that I started doing quantitative EEG. We actually look inside the brain with a good amount of detail that correlates with functional MRI and diffusion tensor imaging, et cetera. It's well established. We can see the different nerve tracts in the brain. We can see the different Brodmann areas. How are they functioning? Are they unstable, excessively stable? It's a tremendous amount of data. I treated a woman who had early dementia and facial blindness, and I was blown away. After I was ready to do the QEEG, the quantitative EEG, which is artificial intelligence, basically analysis through artificial intelligence of the EEG. It's not a visual inspection of the record, it's an artificial intelligence. It picks up things you can't even imagine, and it was developed with a database from the National Institute of Mental Health, et cetera. So it was a solid tool. You do it in the office or in the person's home. And her brain was not normal. And I was very disturbed because she felt a lot better. She still had symptoms. So what we did a combination of hyperbaric oxygen. We did laser transcranial photobiomodulation to her brain. Anyway, treated her hippocampus normalized. It was about 2.5 standard deviations from the norm, and it normalized over 30 treatments. I published this. And her facial blindness, which she had for 7 years, cleared up after the first laser treatment.
Wow.
So we now have tools. You could call it part of functional medicine. I don't care what you call it, but we now have tools to look inside the brain and really see what's going on inside the brain. And we've been able to actually, with 75% reversal of aphasia, visual problems. People have visual snow,
So some of those more cutting edge technologies, where would people go to learn that? Conferences, books, both?
Yeah, I mean, that's what I did. I studied QEEG. I went to conferences on HBOT and learned about lasers, and I did it. I'm just not. I would train people, but I would need a group of people to train. And I get one or two people here or there, but my time is so precious that I can only do it if I have a group of people to train. Then I'd be happy.
So at our talk tonight, we have a lot of people in the field of psychiatry. There's med students, there's residents. What might you encourage them with on their journey since they're just starting off in the field of psychiatry?
You're just starting off. Follow what my mentor Frank Calabat said. Keep learning. Keep an open mind. We don't know everything. Most of what is out there, we don't know. We like to think we know a lot, but we don't. And psychopharm and psychotherapy are great. Don't throw them out, but they are not the be all and end all, and they're not going to do the job for most people. We know that statistically that for mood disorders, anxiety disorders, they are useful tools, and but you really want to address the whole picture. That's again why I call it whole psychiatry.
Mark Hyman's favorite question. We'll end on this one. If you could be king for a day and someone put you in charge of psychiatry for the USA, what are some things you would do?
You know what? He interviewed me, when I ran rounds at the Cleveland Clinic, and he didn't ask me that. So I think I would support the family. I would build, I would really strengthen the communities and the family. Only thing is, it has to be life affirming. That's the main thing.
Yeah. Enjoy hearing from you. Thank you for those encouraging words.